My name is Nick Reyes. This is the class Evidence-Based Practice for Professor Felmo Kiocho. My subject is PPD or postpartum depression. So for PPD, I started off with PCOT. P standing for postpartum women within the first few weeks of delivery. I for intervention and implementation for routine screening and postpartum depression. C for compared to inconsistencies of screening practices. uh, O for the outcome improvement rates for earlier detection and stop and early mental health screening treatment. T is for the actual time frame within the first 6 weeks. And then just a little knowledge about it. Unrecognized mental health disorder, 1 out of 7 women. So you see the symptoms between the first 6 weeks to within the year. Your nurse's role is earlier detection and support women no matter if they seem fine or if they're actually going through depression. Postpartum depression impairs bonding between mother and baby. This increases mobility and mortality rates. Earlier detection, such as timely referrals, early diagnosis, and both of these will improve the overall outcome. So a little background behind it. This is I deem it as a worldwide thing, not just a state or a country thing. So 10 to 20% of women globally go unnoticed because it is untreated or undiagnosed. The earlier the screening for depression and anxiety, the better, because we know how to approach it. Research sways, so a lot of articles I read, so research sways into saying PPD has long-term consequences for baby and mother. This delays development, increases suicidal ideations. So nursing-led interventions, because you're the nurse, you're the frontliner. The doctor might be the doctor, but at the end of the line, you're there 24/7 with your patient within your shift. So the nursing-led intervention improves outcomes. The implementation of a structured screening and overall management of PPD, education and supporting your patient to reduce anxiety. But regardless of all of this, there's still gaps no matter how we look at it. So evidence-based project, this empowers the nurses to advocate for the patients. This leads to early screening and overall improves maternal well-being and family health, which is at this point mom and baby. And then the project's background, a little behind it, is the primary objective is to promote early diagnosis of PPD during hospital stay. During this initial referral and screening protocols, we have the SMART objectives, implementation of standard PPD screening, EPDS. I don't want to pronounce that because I will slaughter that first name out of respect. For all patients before hospital discharge, the scale, train all OB and postpartum nurses on how to administer the EPDS and start appropriate referrals. This increases rate of redetection to start within the first 6 weeks. Staff compliance within screening and referral protocols, 8 weeks of audits, and between those audits, we weekly between week 1 and 8, we do 1, 2, 3, 4, 5, 6, 7, 8 audits, and 85% adherence. This will overall help moms out there. For the study designs and project approach, we want pre and post evaluation, implementation design. This evaluates effectiveness, compares baseline data with overall outcomes. The assessment is better, and overall nursing practice gets better. Interventions on practice changes. We have the protocol and EPDS, which is a scale, and it's backed up by sources. So for the first 24 to 20 hours, we have the actual score. It is the road to any implementation for the first weeks as an overall healthcare team and their support from OBGYN all the way to your doctors to the nursing staff. We want to start the screening, the referral, and training nurses. We the 6 week gather the feedback and the process, week 7 to 12. Screening protocols for the postpartum unit, monitor compliance and audit charts, and communication between teams. For the evaluation methods, we want to address barriers such as language barriers, overall, learning be the majority of PPD patients screened. That's what we percentage of positive screens initiate the referrals. And experimental treatment involved patients know why they're here and they know what they get. The guinea pigs for nothing. This is reviewed expected coordinated, of course. So expected is increased screening compliances, detections, and referrals. This improves maternal mental health outcomes, better overall nursing practice and care, improve quality for the care of the patients. Implications, patient safety, quality of care, enhanced nursing practices, and the better you learn, the less time you use towards it, and you're cutting the cost of charging the patient. In my conclusion, evidence-based practice is a method that focuses on better overall outcomes by managing PPD and symptom detection, screening and referrals. By starting this early and routine screening for women drastically, reduces PPD and the harmful effects to mothers, baby, and this comprehensive care is what we seek. And we as nurses have to, you know, want the best for the moms out there.